Myeloma is again the superstar at this ASH 2025 annual meeting in the city of Orlando. We have fantastic, beautiful weather, but also really great data in myeloma. I can spend several hours if I need to give you all the data. However, I think we need to focus on some really cutting-edge breakthrough piece of information. First of all, late-breaking abstracts. Out of 6, 2 are dedicated to myeloma. The in vivo CAR T cells, very unique, first in human, phase 1, by colleagues from Australia, showing relatively limited number of patients, but incredible proof of concept, showing that you can get rid of the sophisticated and hurdle of the logistics of CAR T cells, collecting the T cells with apheresis, etc. And just by giving sort of a drug in vivo, you can generate these CAR T cells. And we have already a signal, a very strong signal of efficacy related to the deep MRD negativity. Another late-breaking abstract is the famous MajesTEC-3 trial, which is allowing and likely bringing the use of T-cell engagers, anti-BCMA bispecific antibodies into earlier lines of therapy, namely early relapse. And this is really a cutting edge, because when you look to the data, you have a progression-free survival advantage, but also overall survival with an incredible hazard ratio, suggesting that tomorrow we may wish to use in early relapse a combination of daratumumab and teclistamab. Obviously, we need to dig a little bit deeper into the data, because the devil is always in the details. And of course, we need to figure out how do the different subgroups respond to this population. And I'm thinking specifically about those patients who are refractory to daratumumab. But clearly, the field is moving in the right direction. We have several communications trying to better understand the safety and tolerance of cilta-cel, an anti-BCMA CAR T cells, in an effort to predict and anticipate some of the neurological complications. Work in progress, I would say. We do have consolidated data about the use of an antibody drug conjugate against BCMA, namely belantamab, and we have matured and additional analysis from the DREAMM-7 and DREAMM-8 trials, Phase III trials, which led to the approval of belantamab in early relapse multiple myeloma. But of course, when it comes to immunotherapy, we should not forget that these anti-BCMA agents, but also the different bispecific antibodies, are being combined with each other. We have teclistamab and talquetamab further confirming the efficacy of this combination in extramedullary disease. But we have great data looking into elranatamab plus proteasome inhibitors plus IMiDs. So you can see the field is moving now towards using very powerful combinations as early as possible in the natural history of the disease. And of course, I cannot skip all the data and analysis about the importance of MRD and how we are going to use it in clinical practice. And please allow me to say a word also in favor of the quality of life studies. we're seeing more and more of these studies, which I believe is something extremely important for the patient. But also we can see innovations in terms of to improve the quality of life of patients. And this is where I think the data coming about the OBI, the on-body injector, which is used now to deliver cetuximab, is quite exciting. So overall, I think the field of myeloma, like every year at ASH, is really flourishing. And it's not only about making the buzz about new data, because these new data are being translated now into an improved outcome and survival for the patient. And it is now we're talking about cure. Cure is definitely the key word in myeloma today.